What are the two main components of the X-ray tube? Anode and cathode. Anode electrons are positive. Cathode electrons are negative. The part of the X-ray tube that maintains a vacuum and is made of Pyrex glass is an evacuated glass tube. A filament emits electrons through thermionic emission. What is the anode and the cathode made of and why? It is made of tungsten to withstand high heat. Describe the flow of electrons in the X-ray tube. Filaments in the cathode give off electrons when heated. They travel a short distance at a high speed. They strike the anode with high kinetic energy. Electrons convert into heat in X-rays. Percentage of heat in X-rays created at the anode. 99% heat, 1% X-rays. The collimator is comprised of open lead shutters that permit the radiographer to determine size of exposure field on the patient. Two advantages of direct digital radiography are the speed of image acquisition and the ability to post-process images. List from least dense to most dense 6 radiographic densities. 1 air or gas. 2 fat. 3 water. 4 muscle. 5 bone. 6 tooth enamel. The thicker the body part, the greater the radiation absorption. 3 prime factors that are controlled by the radiographer are MAS, or milliampere seconds, kVp, or kilovoltage peak, and distance. Milliamperage determines the amount of X-rays produced per unit of time. Kilovoltage determines the wavelength, the penetrating power of the X-rays. Greater kVp, or kilovoltage peak lowers the patient dose and increases contrast. Greater the MAS, or milliampere seconds increases the patient dose and image darkness. Milliampere seconds is responsible for patient dose. The equation to find total MAS is milliamperage multiplied by seconds. As distance is doubled, the intensity of the beam decreases 4 times. If distance is decreased by 1/2, the intensity of the beam increases 4 times. 4 characteristics of a radiographic image are image brightness, image contrast, spatial resolution, and distortion. Areas of greater brightness, which appears as darkness, indicate less dense areas of the body. Image brightness is determined by the intensity of radiation striking the image receptor. Contrast is the difference in density or grayness of a radiographic image. Subject contrast is the contrast of the subject compared to the surrounding area in a radiographic image. kVp, or kilovoltage peak, controls the degree of penetration of X-rays through the body. 3 commonly used contrast agents are barium, iodine, and air or gas. A grid absorbs scatter radiation. Spatial resolution is defined as the sharpness of lines or clarity, the accuracy of an image. 3 things that have the greatest impact on spatial resolution are SID, source to image distance, OID, object to image distance, and patient motion. Higher resolution is obtained using the longest practical source to image distance and lowest practical object to image distance. Distortion is defined as misrepresentation of the size or shape of the object being examined. Size can be distorted by magnification. Shape can be distorted by foreshortening and elongation. Radiographic distortion is the result of source to image distance, object to image distance, and beam alignment. Milliampere seconds controls radiographic quantity. Kilovoltage peak controls radiographic penetration. Fluoroscopy is a live-action view of the interior of the body. In fluoroscopy, the image intensifier is a detector that receives the X-rays, converts them to light and electronically brightens the image, and then transmits it to the monitor. Computed tomography provides cross-sectional views of the body. Magnetic resonance imaging provides cross-sectional views of the body without the use of ionizing radiation. Nuclear medicine provides images of major organs by introducing radioactive material into the body. Diagnostic medical sonography provides sectional images of the body by using high-frequency sound waves. Luminescence is the emission of visible light. The 2 types of luminescence are phosphorescence and fluorescence. Fluorescence is a glow that is emitted only when stimulated. In film, 95% of the image is formed by light. A latent image is the invisible image on film before processing. A manifest image is the visible image on the film after processing. In CR, computed radiography, a reusable screen captures the X-ray and converts it into light, which is then taken to the PSP and converted into an image. Computed radiography is a digital imaging technique that uses a photostimulable phosphor plate to capture X-ray images, which are then converted into a digital format for viewing and processing. Phosphors are from the barium fluorohalide family. The active layer in CR photostimulated plates is made of photostimulated phosphor. A recumbent patient is lying down. In a decubitus position, a patient is recumbent and the X-ray is horizontal. External preparation of the patient includes removing jewelry or clothing that may be covering the area where X-rays need to pass. Internal preparation may include these 3 processes. 1. Cleansing enemas. 2. NPO, which means nil per os, Latin for nothing by mouth. 3. Contrast media. Barium cannot be absorbed by the body. Using air along with barium or iodine provides contrast to the image. A comminuted fracture means the bone is broken into many pieces. A compound fracture means the bone has broken through the skin. A Colles fracture pertains to the distal radius. A Colles fracture is a specific type of distal radius fracture where the broken end of the radius bone in the forearm bends backward, towards the back of the hand. It's often caused by falling on an outstretched hand, particularly with the wrist in dorsiflexion. Dorsiflexion of the wrist is the action of bending the hand and wrist upward, towards the forearm. This movement is the opposite of palmar flexion, where the hand bends downwards. A greenstick fracture is a partial bone break where the bone bends and cracks on one side but doesn't break completely through, similar to a young, green tree branch breaking. It's more common in children due to their more flexible bone structure. A pathologic fracture is a break in a bone that occurs due to a pre-existing underlying disease or condition that has weakened the bone, making it more susceptible to fracture than normal bone tissue. These fractures can occur with minimal or no trauma. The standard SID distance is 40 to 48 inches. For chest radiography, the SID is 72 inches. Two positive contrasts are barium and iodine. Positive contrast appears as bright white on an image. Negative contrast appears as black on an image. Air or gas provides negative contrast. A type of contrast that is usually better for the patient's comfort is iodine. An esophagram, also known as a barium swallow, is a diagnostic imaging test that uses X-rays to examine the esophagus and the upper part of the digestive tract. It helps doctors evaluate the structure and function of the esophagus, identify abnormalities like ulcers, tumors, or hiatal hernias, and assess swallowing difficulties. An upper gastrointestinal series is a study of the stomach by using fluoroscopy to evaluate how the stomach handles a contrast medium. Also known as a barium swallow or UGI series, is a series of X-ray images taken to visualize the esophagus, stomach, and part of the small intestine. The process of boiling off electrons is called thermionic emission. In an X-ray apparatus, the filament is a crucial part of the cathode assembly. It's a tungsten wire coil that's heated by a low voltage, high amperage current. This heating process causes the filament to emit electrons, creating a cloud of free electrons, which is then accelerated towards the anode to produce X-ray. An X-ray apparatus uses an evacuated glass tube, also known as an X-ray tube, to generate X-rays. This tube is designed to create a vacuum to facilitate electron movement and prevent interference that could disrupt the X-ray production process. The tube contains a cathode, which emits electrons, and an anode, where the electrons collide and produce X-rays. In an X-ray apparatus, the anode disc is a crucial component where X-rays are generated. It's a metal disc, typically made of tungsten or copper, attached to a rotating rotor within an electric motor. The anode receives the electron beam from the cathode and emits it as X-rays. This disc rotates at high speeds to dissipate the heat generated during X-ray production. In an X-ray tube, the anode stem is a crucial component connecting the anode, where X-rays are produced, to the rotor, the rotating mechanism. It's typically made of molybdenum, which is a good conductor of heat but also a poor conductor of electricity. The anode stem's purpose is to transfer heat away from the anode and also to provide a path for the electrical current. In X-ray apparatus, the stator is a stationary part of the electric motor that drives the rotating anode, target, at high speed. The stator creates a magnetic field that induces current in the rotor, causing it to rotate. The anode, usually made of tungsten, is attached to a copper rotor, which is spun at high speeds, typically up to 10,000 revolutions per minute, by an electric motor. This rotation helps distribute the heat generated during X-ray production. A double or dual focus X-ray tube will have two filaments. ERCP, or endoscopic retrograde cholangiopancreatography, is a procedure used to evaluate biliary and pancreatic pathology with an endoscope. The inverse square law states that the intensity of X-rays is inverse to the square of the distance. A cystogram is a study of the urinary bladder. An angiogram visualizes the arteries and veins of a particular body organ. It uses a special dye, contrast agent, injected into the bloodstream to make the blood vessels visible during the X-ray process. An arthrogram is an X-ray of a joint. A hysterosalpingogram is an X-ray of the uterus and fallopian tubes. A mammogram is an X-ray of the breast. A myelogram is an X-ray of the spinal cord. A cholangiogram is an X-ray of the bile ducts. A barium enema provides contrast for X-ray examinations of the lower GI tract.